Uh, this is a mobile phone based intervention. It's a very basic mobile phone based intervention. It's not an app. It does not require a fancy phone. It does not require a smartphone. Your ordinary phone, mobile phone, should be able to work with this intervention. It's a text based or an SMS based intervention, which basically is delivered over a few weeks. You receive messages a few days in a week for several weeks, and these are around increasing your understanding about tobacco, but also helping you with develop skills which help you to stay away from tobacco if you want to stop tobacco use, be it smoke tobacco or smokeless. We are trying to leverage the advantage of the high teledensity in India, which is the high penetration and coverage of mobile phones and mobile phone services in India across rural and urban areas, and leverage that advantage to increase access through a mobile phone delivered intervention, which does not require, as I said, I mean, does not require smartphones, does not require any high end technology, and does not require high end digital literacy for people to be able to access this. Through this project at the moment, we are testing the intervention to see whether it's acceptable to people, it's whether it's feasible to deliver it, and we are at that stage of that intervention development. And although there have been some text messaging interventions that have been tested successfully in other countries, such as the UK, these have been designed predominantly for smoked tobacco because that's the more prevalent use in especially in Western countries. But in countries like India, it's the smokeless tobacco which is the more commonly used version. So, for example, gutka, khaini, etc. And so our intervention has to be something that is that works potentially works for both smoked and smokeless tobacco. And hence, yes, our intervention has been designed to work in both smoked and smokeless tobacco.
The de-addiction campaigns that we already have, how different is this campaign that you have launched? So what is the USP of this campaign?
Well, I mean, the key USP is its accessibility, right? Although we have had a lot of conventional models of helping people to quit tobacco, these conventional models are contingent on a very key resource, which is a human being to deliver that intervention. Now, that key resource is at a premium, or is there's a shortage of that key resource in this country with such a large population, almost a third of which is using some kind of tobacco. We do not have the human resource to be providing these interventions. The other issue is about where and when these conventional interventions can be delivered. For someone who wants to quit the tobacco, to receive that intervention, they have to be able to travel and go to a place where that human being is delivering that intervention. Now, using technology takes away those barriers. The person who wants to quit tobacco does not have to travel long distances to go to a clinic to meet a health professional who can maybe help, maybe not help them, because they might be trained, they might not be trained to deliver these conventional models. Uh, they do not have to do this within, let's say, the working hours of the clinic. So what the USP of this intervention is that you don't have to rely on human beings. You don't have to travel long distances to get this intervention, if at all. And they can access this intervention as and when they want. I mean, this does not have to be during conventional working hours. They could do this, access this intervention on any day, at any time of their convenience. And so
So
that's
how
the
does this
USP of this intervention.
so how does this program work? Is it linked to any call centers or any doctor on call, or what is the backend system that is going to work?
Not at all. I mean, these are pre recorded or pre-designed and pre I mean, these messages which have been uh, locked, and these are messages that have been uh, fed into the system, so to say. And when anyone expresses the desire to access this intervention by calling up the number that we have specified in these social media dissemination messages that we're putting out, they start receiving the messages. So that's the second beauty of it, right? I mean, you once you are into the program, you kind of automatically start receiving the messages, and the whole idea is that this intervention is potentially scalable because the messages are pushed out by a machine once you have registered onto the program. So you don't really need human beings to kind of even deliver the messages, and that's kind of taking away that human interface, which is a big barrier to delivering these interventions. So once you have registered for the program, you'll continue getting the messages. And even if you needed a human being to do this, the whole idea is that it's just one human being sitting somewhere in the country, anywhere in the country, who can deliver these messages to anyone across the country. So you're not limited by geography. You're not limited by the number of people you have to deliver this intervention.
What kind of response you are expecting? You're expecting an overwhelming response to this project. What is your expectation?
Well, the hope is that a lot of people will respond to it because a lot of people do use tobacco. But we also understand the limitations of the current limitations that we have because of the pandemic, and having to kind of put this messaging out through primarily through social media, which means that there are limits to who has access to this messaging in terms of knowing that a program like this exists and accessing it. In the absence of a pandemic, we would have been doing a lot more to put the message out there, which would have also included screening and identifying people in the communities and health centers. Now that is now closed because of the pandemic situation, but that's still okay. I mean, we can't do anything about it. At the moment, we are focusing on getting this message out through social media and expecting people to respond. But once things change with regards to the pandemic, or thinking about this in the longer term, this if this has to get to a large number of peoples across the country, then the dissemination has to be beyond social media, because not everyone has access to social media. So that's the longer term goal. But right now we are restricted by the pandemic situation. We are not complaining. It's not something that we can change. So we are kind of making the best of the situation by using social media to put the message out there.
Considering that smoking affects lungs and it has been directly correlated with COVID infection vulnerability, do you think it is a very good time to launch this program, considering that COVID has again resurfaced?
Yeah, I mean that correlation. I mean, our program kind of launching and the COVID pandemic happening is incidental. But yes, I mean, you're right. I mean, what has been seen and what we do know is that use of substances as a way to deal with stress is very common, and these are stressful times, and one would expect that the use of substances would go up, and at the same time, it also means that the pandemic situation also means that the access people have to services becomes severely constricted, because the health services are, and rightly so, I mean, focusing on providing a response to the pandemic and its consequences. And so people with any kind of mental health problems or stress or substance use are severely limited in the kind of access they have to any services. And so in that kind of a scenario, if anyone wants to stop the tobacco use, going to a clinic and meeting a health professional is not really an option that people have at the moment. And in such a scenario, I believe that having access to these kind of services through technology is very, very important and very, very useful. And so, although this was not how it was planned, it's something that has happened, and I hope that people find it useful because they are able to access a service sitting at their homes.
So what would be your message for our viewers? What they should look forward towards this program?
Is basically this, that if you want to stop tobacco, we have this intervention out there which you can access from the safety of your homes. As long as you have access to a simple mobile phone, get in touch with us and we'll be able to send you this intervention. But the other thing to also remember is the larger environmental causes around tobacco use. So while this program is designed to provide an intervention at the individual level, we also have to be mindful of what's happening in our environment, which is promoting the use of tobacco in the country. And one big kind of such an environmental factor is surrogate advertising, which we don't realize that it's in our midst and is promoting the use of tobacco. So if you watch the television these days, and if you watch, let's say, for example, the IPL, you see that there are a lot of surrogate advertising that's happening around tobacco. So you have these flavored elaichi and pan masala being promoted by some of our biggest stars at the moment, like Shah Rukh Khan, Ajay Devgan, Salman Khan, who are putting this messaging out there that this is a mouth freshener, this is a pan masala, this is a flavored elaichi, but the and I don't know how much of them understand the problem with this, because all of these are basically surrogate advertisements for tobacco. When you go out there and to your local pan wala or tobacco shop, these very same names which are selling that flavored elaichi. You get the gutka and other tobacco products under the very same name and exactly the same packaging. And then you kind of see things like these huge billboards which are advertising just the same products. Even in Goa, I mean, if you are on the Atal Setu and you're crossing the bridge, you see this massive big billboard. I think it's if I remember correctly, for Vimal pan masala, which is you can't just avoid seeing it. It's just so much in your face. And so as responsible public, we have to be mindful of this kind of surrogate advertising that's coming from uh, our quote unquote role models, and then like Bollywood actors, and we have to be very mindful of that as well. What a program like ToQuit can do is help you at an individual level, but what it can't do is kind of have an intervention or try to intervene at a larger environmental and policy level, and that's something that I would kind of strongly request your viewers to be mindful of.
So our youngsters, especially school-going kids who are very vulnerable, considering that these tobacco products are still sold very near to these educational institutes. Is that a point of worry, and do you think the government is it doing enough to stop this menace?
Absolutely. I mean, it's definitely an area of concern. So as with any other law or policy, it's not good to have a policy or a law on paper unless the implementation is done in its full letter and spirit. These policies and laws, however much their intention, however good their intention might be, if they are not implemented in their letter and spirit, they are going to fail. And so, yeah, I mean, although the government is doing its bit to ensure that these tobacco products are not available closer to educational institutions, etc., unless we kind of crack down on the surrogate marketing, surrogate advertising of these products by people who can influence the thinking of the public, unless we crack down on that, we have a very, very long way to go.
Thank you, sir. Thank you for giving your precious time to us. It is always an honor and a privilege to talk to you and get insights, important insights from you. We wish you all the very best for this endeavor.
Thank you, Shaswat. Always a pleasure to talk with you and to kind of put a message out there for your viewers. Thank you.
Thank you, sir. Thank you, sir. Take care, sir. Good day.